Hi, I'm Charlie. I'm with Pharmacy. And today we have Angelina. She's a 37-year-old African-American female. She has a chief complaint of fever, cough, and fatigue over the last 5 days. She also presents with sputum production, shortness of air, and myalgia. The symptoms have been gradually getting worse, and she's unable to fulfill her daily duties. She also has asthma and seasonal allergies, but those are well controlled. Her past medical history is hypertension, asthma, and seasonal allergies. She doesn't have any significant family history. Her social history is she's a non-smoker. She has 4 glasses of wine per week, denies illicit drug use, currently not pregnant or breastfeeding. She's a social worker and has 2 young children, so there could be some possible ways that she's exposed to some sort of pathogen. She has a latex allergy that results in a rash. She also has a penicillin allergy that results in diarrhea. She's currently taking calcium carbonate, 100 milligrams, 1 tablet by mouth twice daily. She also takes atenolol, 50 milligrams, 1 tablet by mouth once daily. She takes a prenatal vitamin, 1 tablet by mouth daily. She has a Pro Air inhaler, 180 micrograms, 2 puffs inhaled as needed every 6 hours. She also has a Brio inhaler, 100 over 25 milligrams, 1 puff inhaled daily. And she also has fluticasone, 50 micrograms, 1 spray intranasally daily. She's up to date in all of her childhood vaccinations. She received the flu vaccine in October of 2019 and received the pneumonia vaccine January of 2008. For ROS, she has chills, fatigue, fever, malaise, congestion, cough, sputum production, shortness of air, chest pain, but she doesn't have any wheezing. Physical exam didn't seem to present with any issues. Her blood pressure is 128 over 72 millimeters per mercury. Her heart rate is 83 beats per minute. Her temperature is 101 degrees Fahrenheit. Her respiratory rate is 16 breaths per minute. She's 5 foot 10 inches, 150 pounds, and her BMI is 21.5 kilograms per meter square. Her labs show elevated white blood cells with 13,000. She was negative for a rapid flu test, and all other labs are within normal limits. Her creatinine clearance is 92 milliliters per minute, and she had a diagnostic test of a chest X-ray that showed right lower lobe pneumonia. So she has community-acquired pneumonia, and due to the X-ray showing the pneumonia and also her having consistent signs and symptoms with pneumonia, like the fever, productive cough, chest pain, and shortness of air. Also, she has a CURB score of 0, so we should treat her outpatiently. She had elevated white blood cell count, and according to the Community-Acquired Pneumonia Guidelines, IDSA 2019, since she has asthma and hypertension, she should be treated with a Category 2 regimen, and that they recommend augmentin and a macrolide. So I chose augmentin extended release, 2 grams by mouth every 12 hours for 5 days, as well as azithromycin, 500 milligrams by mouth once daily for 3 days. The goals are to eradicate the infection, relieve symptoms of pneumonia, and restore daily activities. For safety monitoring of augmentin, just want to be cautious of the GI upset that it can cause. And for the safety of azithromycin, it can cause elevated LFTs, and QT prolongation. And then for efficacy, we just want to monitor that her symptoms are improving from both drugs.